and thank you everyone for being with us. Gloria acted as the lead analyst on this project, and using the academic term, I'm the principal investigator. First off, I want to thank all of the folks who supported us. It is a long list, and we are very proud to be associated with all of these allies for good. I'm not going to read through them all, but you can see the impressive list. We thank you not only for your financial support, but perhaps even more importantly, the provision of good lists, nice clean lists of your grantees and other constituents, and then also the encouragement of those folks to respond. So we thank you for that. I also want to talk a little bit about the plan for the presentation. I'm going to go through background, objectives, and method pretty quickly, and also the sample profile. We're going to spend a little bit of time on the sample profile because I want to kind of emphasize just how clean and powerful the database that we've developed is for not only the top line analysis, which we'll talk about today, but some of the regional analysis and the subsector analysis we can do. So we're appreciative of that support again. And then we're going to talk about the financial health of the nonprofit sector, impact of PPP, of the CARES Act. We've also organized this where we were going to talk about the impact on people, both clients and staff. Then we'll summarize it with the road ahead and silver linings, and then I'll do some observations and considerations at the end. The background, as you know, and I'll do this quickly, onset of COVID-19 in South Carolina, roughly mid-March of 2020. In September of 2020, Together SC partnered with the Riley Center at the College of Charleston to conduct a survey of nonprofits. At that time, both Gloria and myself were at the Riley Center, so we're doing the same piece of research or updating that piece of research, but under the Kahle Strategic Insights banner. These hard data helped frame the South Carolina legislative response to the pandemic and the $25 million that were set aside for nonprofits. And we also are pleased to share that information and today's information with our philanthropic leaders and the nonprofit leaders. This research, more than many that I've conducted over the many years, really hits home with us. We have almost 9,000 people who've died in South Carolina, including folks who were close to me. More than 500,000 cases have been recorded for Gloria as well. She's had close contacts that have been seriously ill from this virus. So it's meaningful stuff to us. Our objectives to assess the financial status and well-being of the sector. We're going to look at region and subsector, the effectiveness of those financial supports. And as I said earlier, the impact on people, what does the road ahead look like, and what are these silver linings? All right, with that, how did we do this? Well, we got a list provided by investors and supporters of their grantees and constituents. We're also fortunate that Together SC could get the list of South Carolina CARES applicants and grantees. So we had both those who were awarded as well as those who were turned down. And then we had the members of the Together SC organization in that list. And we augmented the list from the fall 2020 study and updated that with the new stuff that we have. Part of the process that you don't ever see, but was just a critical foundation to putting this research together, was the deduplication and data management that Ben and Gloria did. This is very detailed work, painstaking work, not a lot of glory in it, but it sure made for a nice clean sample for us. So thanks to Ben and Gloria for that work and the teamwork on it too. So this resulted in 3,718 unique valid email addresses of leaders of South Carolina nonprofits. We only accepted one response from each organization, so it's really an organizational level study, not an individual level study. With that, we sent them emails to a online survey of 35 questions. If they're in the arts, 30 if they were not in the arts sector, and we collected data from March 1 through March 12. This resulted in 927 complete and substantially usable data. That's more than 360 more than what we had in the fall. So 24.5% response rate this time compares to 566 and a 19% response rate from the fall. All right, sample profile quickly. The first thing I want to point out is that we have very high-level folks who are responding to this survey. About 79% are either the CEO or the executive director. In most other cases, a board member or a CFO or COO. This is a little bit lower in terms of the CEO percentage than what we had in the fall. But we believe that's largely because we have a lot of larger organizations this time. And for a $10 million organization, it's reasonable for the CEO to ask a CFO to do this. We also know that many of our respondents printed the PDF survey, worked with their team to complete it, and then one person entered the data. So especially with the questions that were specific to number of employees, budget stuff, they went and retrieved that data. Interestingly enough, we asked the race of the CEO and ED as we did in the fall. The percentages are a little bit higher in terms of the number of African-American leaders that we have represented here. Importantly for us, that 188 is about 190 some odd people in addition to what we had in the fall, which will allow us to do more meaningful analysis of this data by race. Statewide, the numbers are higher, but the proportions are almost identical to what we had in the fall. Note that we even got 65 from the PD here, our smallest region, and that's going to allow us to compare and contrast across all the regions. In terms of the respondents per county, out of the 46 counties in South Carolina, we have 44 represented with at least one respondent. Only Saluda down here and Chesterfield over here had 0 respondents. Check this out. We're looking at 142 in Richland, 125 in Charleston. Whoops, I went a little too fast there. 125 in Charleston, 62 in Beaufort, 38 up in Horry, 116 with our good friends in Greenville, and 51 with our partners in Spartanburg. So this gives us some data where we can actually analyze at the county level, not just the regional level. We like at least 40, so we're close to that in many of these counties that we know are key. And the county level analysis, from what we understand, legislatively is going to be important as we move forward. By sector, human services is by far the largest. Arts and culture and humanities, education next on the list. Importantly here too, we have 46 in environment and animals and 48 in the religious organizations or religion-oriented, or related, I should say. That gives us enough so that we can do analysis at that level as well. Foreshadowing a little bit, we find in this environment and animals segment some troubled organizations. And what we are learning is that some of those animals that were adopted early in the pandemic are being returned late in the pandemic, putting a lot of pressure on our organizations that care for abused and neglected animals. Respondents by budget. So this is different than what we had in the fall. We have 23% or 206 respondents that are in the less than $50,000 category. This is twice what we had in the fall in that category. But look at the high end, on a $10 million plus, we got 22. In the 5.1 to 10 million, we got 19. Those are substantially better numbers than what we saw in the fall, and allows us to do analysis of both the largest and the smallest and everything in between. FTE range, this is a little different, and you're going to see more of this FTE data in a few minutes when Gloria presents it. Rather than asking to be put into categories, we asked for the exact number of FTEs that they had. And recall, we did this at 3 times. Where were they at March of 2020? Where are they at March of 2021? And where do we expect them to be, or where do they expect their FTE count to be in June 30 of 2021? So more on this in a moment. I'm going to do just a couple of these slides on financial health, and then I'm going to toss it to Gloria to talk about CARES Act and some of the other things we have to share with you. All right, so some of you might remember this graph from the fall. This is our months to operate without additional revenue. So assuming you're not going to have any new revenue coming in the door, how long can you operate? Well, we see similarities, but some important differences. The bluish line is the 2020 data, the greenish line is 2021. And so we can see that while we have more organizations, we have the same proportion that are in that 0 month category. These are folks that are really out of money. They're, they may still be an organization in name, but what we've learned is they don't say they're closing their doors, they just stop providing services. However, in this next category, the 1 to 3 month, we have seen a decrease in the number there, and then a corollary increase in the number that could make it 7 to 12 months. Those are both signs of financial health and an improvement. We'll present a couple of other slides on this. It's hard to say what these would look like without the PPP and the CARES funding, but we would speculate that they would be much, much worse off if those federal funds had not been there to support. I know this is a lot of data all at one time. Try to focus just on the left-hand side of the scale here where the 2 different shades of blue are. Excuse me a moment. This is one indication where we really see the concern in the arts, in the environment and animals, with 36% being in these lowest, less than 3 months to operate. We've also seen a big change in education where the numbers in the fall were pretty negative here and are improved now. The other thing to note here is in the religious related organizations, they are by far at more risk than the others, where you have more than 40% who are indicating that they can only make it 3 months or less. Okay, now we're doing the same thing here by region. Again, quickly, we see the PD, as you might suspect, a lot of smaller organizations there. They're in the toughest shape regionally across the state. The statewide organizations are doing pretty well. Upstate and low country are, among the more financially healthy, with the Midlands, no pun intended, in the middle. Here we're talking about by size, and this is based on their reporting annual operating budget. So it's interesting here that these smallest organizations are the ones who, again, I'm clicking ahead, I don't mean to. These smallest organizations are the ones that have the biggest risk of going out of business or already there. But note here in the 5.1 to 10 million category, where we got 33% of these organizations that are large, significant operations that indicate that they can only make it for 3 months with the amount of cash on hand. So while things are better and they're improved from where we were in the fall, there is still a rough road ahead for many of these organizations. Okay, I'm going to present this one, then I'm going to toss it to Gloria next. What we did here is we asked the question of what was your financial status at the end of your last fiscal year? And they could respond with a slight operating loss, a significant operating loss, a slight excess revenue, a significant excess revenue, or even. And we see a pretty equal split here with a 40% in total having excess revenue, 42% having an operating loss, and about 18% in the middle. We present this, it's not so meaningful in total, but we use this as also a dependent variable to look at the impact of the CARES Act. And Gloria, I'm going to toss it to you at that point.
All right. Hi, everyone. So here we see the sources of financial support. This was a multiple response question, so that's why the percentages will add up to over 100. So we see that 60% of our sample did receive some sort of federal assistance, most in the form of the Payroll Protection Program. And then the second highest was the CARES Act at the state level at 40%. Foundations, individual contributions, and corporations making up the next largest segments. So here we take a look at the Payroll Protection Program in comparison to months to operate. The blue category is that the organization applied for this funding but did not receive it. The green is that they did receive it. We see stark differences in this 0-month category, with those that applied but did not receive at a much higher rate of 8% than their counterparts who did receive it. And then we see that flip side at the 13 months or more operation for the received category. So it's obviously making an impact for these organizations that did receive it. Next, we look at receiving payroll protection and its impact on the last fiscal year revenue. We combine some of these categories for a loss, even, or excess, and we see the correlated loss and gain among organizations at a 10% difference. We see in the loss, it's 55% compared to the 45% for those who did receive payroll protection.
One of the important things when we're looking at these graphs is not so much the individual numbers. I mean, they mean something, but we see the same trend in the data over and over. If they got the PPP, if they got the CARES Act funds, they're doing better. If they applied and didn't receive it, they're not doing as well.
These next couple of slides will look very similar. It's moving from the Payroll Protection Program to the CARES Act funding. This does combine CARES Act for the county level, which includes a lot of our Greenville organizations, and it includes the state level CARES Act. Again, it's applied but did not receive versus those that did receive. And again, we see a much higher rate at the 0-month for those that applied and did not receive. But then we see that gain at the 7 to 12 months and 13 months or more in the received category, showing better health of the organization when they did receive this funding. Something to keep in mind when we're, sorry, skipped one. This is impact on the last fiscal year revenue. Again, we see that gain for those that did receive it and having a slight excess revenue at 37% versus the 28% that did not receive. And again, the key one here is that the significant operating loss being the most severe, we see at 35% of organizations having a significant operating loss when they applied but did not receive, versus only 22% for those that did receive the CARES Act funds. And what's important to keep in mind when we're looking at these applied but did not receive versus received is that there were several barriers that organizations felt when applying to COVID-specific funding. The highest of which was that the applications were too complicated. In the open-end responses, we see repeatedly that the CARES Act funding specifically was very difficult, very cumbersome for organizations to complete. And the other important thing to look at when we're comparing the impact of the last fiscal year revenue or the number of months to operate is that for most of this funding, volunteer organizations were not eligible. So they are not in this category because they most likely did not even apply for this type of funding.
Gloria, before you move
now
on.
We'll move into,
move
on to, I'm sorry.
I just want to make the comment that the link to this report is in your chat. So if you want to download this, is it there yet, Ben, or not?
I was going to hold off until y'all were done, but I can pop
We're all
it in
done.
now.
Okay. We just want to let you know that we're running through this pretty quickly, but we're going to give you all the PowerPoint at the end so that you can download it and have the data in its entirety. Sorry to interrupt, Gloria, please.
No worries. So we'll move to the impacts on staff and clients that we've seen in this. So we looked at full-time employee equivalent gains and losses during the 3 different periods. We measured, how many employees did you have March of 2020? How many do you currently have of March of 2021? And how many do you expect to have in June of 2021? What we see here is that the change from March 2020, the start of the pandemic, to roughly today, our sample saw a loss of 7.5% of its workforce. What's notable here is that there is a study from Johns Hopkins in their Center for Civil Society Studies, where they have done a very similar comparison of nonprofit sector job loss, and they find a 7.4% difference for a loss. So we were right on track with that national study, proving that this data is reflective of good response rate and good quality data. The positive in this particular data point is that the expected change from March 2021 to June 2021 is that the sector expects to bring back about 3.5% of the workforce that it lost. While this is a great positive, unfortunately, the expected change, if we look at March of 2020 last year at the start to what is expected at the end of June, is still a loss of about 4% to the sector. This obviously impacts the ability for an organization to complete its mission, and obviously puts more pressure on individual employees that are still working at these organizations. We look at the full-time equivalent changes by sector and see some pretty stark losses in the arts, culture, and humanities sector, as well as the public and social benefit. These 2 groups are also less likely to bring employees back in June as well. But we do see a much higher positive in the health sector, bringing back more employees than they had at the start of the pandemic, which is to be expected. So we take this data point and look at the regions served, and here we see that while the PD is suffering, we see in earlier data points in terms of their needs, how likely they are to be closing soon. We see that they have retained their staff at a higher level than any other region, and that statewide organizations have also retain much of their staff. Unfortunately, we see in the Low Country a 14% loss of staff from March of 2020 at the beginning to today, and only bringing back a portion of that. They will still see about an 8% difference from March of 2020 to the end of June. This is showing that unfortunately our Low Country organizations have reduced its staff as a way to stay above board and stay current in their mission. The next question we asked was, did staff absences due to direct close contact or quarantining or having a positive COVID test themselves have an impact on the mission delivery for the organization? We find that 63% of organizations reported an impact on staff mission because of COVID effect on staff. Now, this is specific to a close contact encounter of COVID or a positive test themselves, not just an organization deciding to close its offices for a period of time for quarantining, as many did at the start in March. So we're seeing this. The COVID impact on the individual staff members is unfortunately impacting the mission delivery that organizations are able to provide.
I forget who it was who asked us to put this question in. I think it was from the Habitat for Humanity organization at the state level. We can kind of get lost in this data and talk all about organizational impact. But when we were really going through this and thinking about it and analyzing the data, we decided that we had to talk about the impact on people, not just on organizations. And this is one indication of it. Almost 2/3 of the organization had at least a slight impact, more than 10% a severe impact on their ability to deliver on their mission because of the physical effects of the COVID virus.
So here we see the percent selecting increases demand by area of need. And we see, as expected, we see food assistance and rent and mortgage assistance being our top two highest. Again, this was a multiple choice selection, but that, food assistance is high at 31%. We also see this remote tech learning support still being very high, even a year after we've started working from home more and organizations shifting to more technology support needs. So we found it interesting that that was still remaining high. And something that we'll see throughout the survey results are that mental health services and the need for mental health care for clients, as well as the nonprofit sector employees themselves, is very high. This rings throughout our qualitative and quantitative data, and we're seeing it here at 22% of organizations saying they need assistance because they've had an increase in demand for mental health services.
Yeah, as Gloria is foreshadowing this came out very strong in our silver linings work. We'll comment on it there, but one of the things that multiple respondents told us is because of COVID and the isolation and the other impacts on individuals' mental health, is perhaps there is a lessening of the stigma of acknowledging that we all need some mental health supports through extraordinarily difficult times. Talk a little bit about the road ahead, will you, Gloria?
Absolutely. So one of the large findings of our last study was the cash needs for organizations in the future. And we've asked that same question in the same verbiage this time so that we can have a comparison. This time we put a time frame of through the end of June on this, and the sum total of all of the needs for organizations was this $54 million number. This includes $30 million to help organizations meet operating needs due to lost revenue. It's $14 million to help meet an increased demand of services, and it's $9 million to restructure programs or services due to COVID. This is a very simple calculation. We haven't done anything to manipulate this data or aggregate it in any way. This is simply the sum total of what every organization said that they needed for these three categories.
And we know from talking to our respondents and the comments that they write in the open-ended sections, they were pretty precise and serious in this. And this is where the CFO is sitting down with the CEO and talking about what they need to get through the next several months. So we feel very confident in these numbers, although they're staggering in terms of the size when you think it's only through June 30th. Where are the needs the greatest?
So we've broken out that total amount by sector and found that the human services sector, the total amount needed that they've requested is about $23 million. This is to be expected that this particular subgroup is higher. We have a higher response rate in this area, and just organizations tend to be of larger budgets for this category. But second highest, we see the education sector with a $8.4 million need as well. Next, we broke this out by region to see what different regions needed to support nonprofits. And we see that while we have cited that the PD area is in great need, they also require the least amount to get back on their feet and to be sustainable at $5 million. And the largest region is the upstate at $13.7 million in total need. We break this out a little bit by the three different types of cash needed. It's the blue is cash flow to meet operating needs due to lost revenue. The gray is cash flow to meet an increased demand, and the green is cash to restructure programs and services. For cash flow just to meet operating needs due to lost revenue, we see high numbers in the Low Country and the Upstate. The Midlands needs the highest in cash flow to meet an increased demand of services, which, given the population size, kind of makes sense there. And for cash to restructure programs and services, the Upstate and the Low Country, again, take the highest numbers needed for those categories. Other needs moving forward besides cash, although that's a large chunk, it's 60% of the organizations do need cash, is the second highest was managing a safe return and in-person service delivery. This is quite a challenge for many organizations as they navigate the best way to return their workforce to their offices or figure out how to still provide services in a safe environment. We also see still high numbers requesting supplies even a year later after COVID has started. We see 26% still need just basic PPE, I'm sorry, for cleaning and sanitizing. And again, here we see that high number, the 20% needing mental health support services for both staff and clients. And what I think is important here is that, as we've seen, most of our respondents are the CEO or CFO or COO. So these are the leaders of their organization recognizing that their staff do need this mental health support, which is encouraging that leaders are recognizing this. And it's definitely something that the sector needs after such a difficult year of providing increased amount of services for many of these organizations.
Thanks for that, Gloria.
Thank you.
I appreciate it. We know we're throwing a lot of numbers at you now. I want to talk a little bit more about maybe some silver linings, and then we'll summarize and hopefully have 15 or 20 minutes left to take questions and comments. So we're a bit surprised in the fall that we had such a robust response on the silver linings question. In other words, were there any positive impacts? And we really got them very, very detailed responses here. So when we asked the question in the fall, we got 60% saying yes, there was a positive impact. Now 68%. So a small increase there, but significant. And what kind of things were the silver linings? Well, expansion of services with virtual programming, new partnerships formed. We see this in the open end. We collaborated with our partner on the other side of town or the other side of the county. So certainly there's been collaboration born from necessity and the pressure that COVID has put on our nonprofit sector. Improved community awareness of organizations, expansion of reach, not just more services, but they're reaching further. Think of arts and culture that are doing virtual programming now or digital performances. You don't have to be close to the music hall in Charleston to see the Charleston Jazz anymore. You can see them online and in other venues. Strengthened internal communication is interesting and has come up in more than 10% of the cases. Excuse me. And then last, even though it's only 6.8% of the total, we have 117 organizations that indicate that they've been able to reduce their facility expenses because they've now demonstrated that people can work from home or work remotely and still be effective. So while the percentage is relatively small, having more than 100 organizations that have reduced their ongoing operating expense, we think is a pretty good win for the sector. Now, I know that this is bad PowerPoint behavior because you're going to be a little overwhelmed by all these quotes, but it's kind of part of my intent. I've got to tell you, when I sat down and looked at this open end with silver linings in their own words, it was pretty emotional to read through this stuff. So I want to share each and every one of these quotes with you, and we'll provide more as we continue to report. But very heartfelt. I would also use the term profound in terms of what our nonprofit leaders told us. Starting at the top left, telehealth has been life-changing for people with disabilities. This next one I think is so important, particularly for these after-school programs and the mentoring programs. We know that consistency is incredibly important to children, particularly those who may not have all the benefits of some of the others. So children see our dedication to serve them through our consistency, even during the pandemic. This next one, gosh, it's really forced organizations to eliminate marginal programs and to reinforce the essential one. It has been a process where you had to prioritize or you weren't going to survive. This next one I think is really powerful as well. This CEO went on for multiple paragraphs, and I'm just pulling kind of the summary right here. Receiving PPP funds, SC CARES funding, and some unexpected major funding gifts. We increased our focus, attention, and commitment to racial and social equity. We enhanced our attention and commitment to advocacy, developed new tools, platforms, opportunity for engaging and connecting people with our mission. We think that says a heck of a lot right there in terms of the resilience of our sector. Here's another one: streamlined our services, found more innovative ways to do things. Many of the silos that existed before the pandemic have been eliminated. There is an increased confidence in the leadership of our organization surrounding the organization's response to COVID, and we've gained over 500 new donors. So there's folks who are really making lemonade out of these lemons. An increased atmosphere of teamwork, increased engagement with our board, took time to set priorities for our organization, made needed improvements to our building. Our staff has become more adept at using technology. And then here's the one, and I'm only showing one quote here, but boy, there was a lot of comments on this. People are beginning to see the stigma surrounding mental health and starting to open up. So we think that's a positive as well. So, you know, I'm going to comment in just a moment that I think the sector has been incredibly resilient. And part of the resilience is by seeing and making these positive changes in the face of incredible pressure on our organizations, particularly our human service organizations, who are seeing never before levels of hunger and homelessness. And we don't expect that this is going to end anytime soon. All right, so what does all this mean in the bigger picture? There we go. As I said before, in repeating here, the nonprofit sector here in South Carolina is resilient, but the government support has proven essential. If we didn't have those PPP funds, if there wasn't the CARES Act, you know, we think we would be looking at very, very different data. It doesn't mean that we're going to have an easy road ahead with the data that Gloria shared in terms of dollars and resources needed. It's going to be a tough road ahead, and it's not all going to come from the federal government or the state. We know that we're going to need business resources, and most importantly, strategic philanthropic resources to get the sector back to a place where it can really rebound from this most difficult of years. Some might not like to hear this, but we see this in the data in many, many ways. The sector will continue for the foreseeable future to be mostly about meeting basic needs. We're talking about the highest priorities being the nutrition of our families and the provision of safe housing, medical care, mental health care, and abilities to work remotely and learn remotely will be the highest priority challenges going forward. We'll know we have made it when the arts and culture sector comes back to full life. So when we can go to those performances again, when we can enjoy a night out with a restaurant meal and a play or a concert in person, we know we will be on our way back. Navigating the return to in-person service and work will be a challenge. There's been a lot that's changed in people's behaviors, and their patterns and their habits have changed as a result of the difference in working environments. And we believe that that's going to be a real challenge for the sector leadership to address that as the number of vaccinated folks gets higher and we are able to return to a greater sense of normalcy. I don't know where I'm stealing the term collective trauma, since I don't remember who else used this. I'm going to call it as my original, but we do believe that there's been a collective trauma that we see in the data. The mental health of both staff and clients needs attention. And don't forget about the folks at both the highest levels and the lowest levels in the hierarchy of organizations. We do a lot of work with food banks, and everybody from the CEO down to the driver and the folks who work in the shipping and warehouse, they've all been going 130, 140% of capacity for a year now, and they're exhausted. We see this in our homeless providers as well. So we need to make sure that we practice good self-care and we look out for each other. I am seeing some other data, particularly nationally, that is concerning in regard to violence in the home, violence in the workplace, and suicide. So we want to make sure that we can reach out to folks and comfort and support them. Lastly, the silver linings are profound. And again, I was really moved by the data and the power that these leaders have shown. So we think that could be leveraged for a more impactful future across the sector. And ultimately, we're going to come out of this stronger. With that, I want to thank again the good folks at Together SC for putting together the coalition, all of the investors and supporters who provided lists and encouraged the leaders in the